You are listening to The Future of Work, Water Cooler Conversations, where business leaders share how they integrate humanity and technology to create a better workplace for today and tomorrow. This radio show and podcast is brought to you by Max 6 Entrepreneurial Center. And now, let's listen in as Jen Burrell and Kyle McIntosh connect with today's valued guests.
And we are back with the Future of Work, Water Cooler Conversations. I'm Kyle McIntosh, here with my co-host and good friend, Jen Burwell, and our fascination with business leaders who have developed innovative approaches, healthy cultures, flexible workspaces, and seamless virtual technology. Today, we are excited to introduce you to Dr. Scott Ostdiek, co-founder and chief medical officer, and Eddie Fredericks, co-founder and managing director of WorkingAware. Good to see you, Jen, first.
Well, good to see you.
And thank you for being on the show, guys.
Well, thank you for having us.
Before we get into really what you guys do and really diving into some of the questions about that, we like to start the shows out with where'd you guys come from? Where'd you grow up? How did you experience the world and get from there to sitting in this chair in front of us today?
I'm Scott Ostdiek. I grew up and went to college and medical school in Nebraska. I grew up in a small town just outside of Omaha. I first moved to Phoenix in 1990 for my pediatric training. And while I was there, and even back in college and med school and even to high school, I had interest in immunology and infectious diseases and found that even though those were rotations and training electives where I was working harder than on any of the others, it didn't bother me. It was just really fascinating to me. I went off and did some specialty training in pediatric infectious diseases because I wanted to get to a point where I was an expert in some area, but not be like a left kidney doctor, where I was only treating 3 diseases. And so the general approach to infectious diseases was really appealing. And then I moved back here in 2000 and have been here with my wife and kids since then. I'm working primarily at Phoenix Children's Hospital, but also at the Banner Systems, anywhere where there's significant number of kids in the hospital. And I and my partners were consultants when kids have either got severe or unusual infections or resistant bacteria or just unusual infections where their main doctors need some help in managing them. And coronavirus hits, the pandemic starts clobbering everything. And I'm out for walks in the evening and I go past restaurants that we used to eat at that are closed and stores that we frequent that are really struggling to stay functional during this time, and realize that there's a lot in my background and skill set that I felt I would be able to offer to those companies to try and help them navigate this situation.
Very cool. Thank you. There's lots of questions, but let's
got to keep moving on. Yeah.
Eddie, what about?
Wait, I have one quick question. Sorry.
Yeah.
Just out of curiosity, how many kids do you have?
Me personally, I have 3. 2 of them are in the adult range, young adult, college, and then my youngest is 12 and 7th grader.
Nice. Okay, I just wanted to ask because Eddie and I have talked about children a lot. The two of us, it's good to know. Thanks, Scott. Okay, sure. Eddie.
Yeah, so mine is definitely not as purposeful or cool. I was a wayward lad of 20, and I just didn't know what I wanted to do, and I moved to Arizona, mainly because I think ASU was the first application to come back to me. I think I applied to Colorado State, Oregon State. I'd never even been to Arizona, and it was July of '93, and I immediately regretted the decision and thought, "What am I doing?" And by the following year, I had met my wife. I had made the best friends of my life. Like fell in love with the place. Within a few years of that, I started a career. I was studying English literature. I was thinking maybe I would be a professor, and I ended up in a sales job, which I never thought I would do in a million years. I always thought sales was horrible. I never wanted to do it, and I absolutely just fell in love with thinking about it differently, of helping people and consultative selling. And I was really grateful to start with a company that had people that taught me the right way to look at it. And many years later, I'm here, and it's interesting. You brought up kids. That's how Scott and I got to know each other. So we, both of us, there's a preschool, Desert Sun, and both of our kids went there. His youngest and my oldest were classmates together. And when my youngest was born 8 years ago, I was doing some of the duties of going into the preschool, met his wife, and then, one day we're hanging out, looking at our phones on a Saturday morning at a preschool event, and we find out we're both soccer fanatics. We're both into fantasy soccer, and we actually cheer for rival teams. And that's kind of how the friendship was born. And it's just funny that I don't think we ever imagined that that so many years later we'd be starting a business. It was just not something I'd thought about, but it is definitely a fun story about the magic of those connections,
So,
I'm seeing a theme. Sorry, Kyle.
Go ahead.
I'm seeing a theme in your life, Eddie, of you're not quite sure, and then you fall into all this stuff, and not to say that you didn't work for it, but just then you met your wife, and then you have this, all these things happen, and then the connections. It's so true. You never know who you meet and how it's all going to play out. But I love the serendipity that you have in your story.
Yeah, I think I'm smart. I'm smart enough to just realize how lucky I am all the time, and just recognize that luck. Just barely smart enough, and then not smart enough to be happy. A lot of the time. So it's been good for me.
All I was going to do is suggest we take a left turn and talk about soccer for the rest of the time. So.
Well, we can do that. We can do that right after.
Oh, my connection's breaking up. I gotta go.
We'll convert you, Jen.
You talked about how you guys met and the personal connection, and you had two very different circumstances where you were focused in life, where your careers were taking you. How did you guys, get to the point where you said, "Here's something that we think we could do something together here," and it turned into what is WorkingAware today? But how did that first start out? That conversation?
Yeah, so about a year and a half ago, I started my own business advising company in the dietary supplement health and wellness industry, and really started enjoying working with entrepreneurs, working with companies, and it found a lot of joy there. Scott had been, he'd always been my infectious disease buddy. So I'd call him if I had a rash or if there was something, if there was an issue, I'd call Scott. I knew where that expertise was. Back to the soccer, we have bets all the time of who wins the games. Scott, this year he's having a rough year, but last year he was kind of kicking my butt, and I think it just started off as a joke of we would bet. We don't bet money, we bet lunches, and we hang out with each other. It's a win-win, but picking up that tab is the cost. And I think it just started with Scott mentioning, hey, we got to help some restaurants get open so that we can, you owe me some lunches, sort of thing. And you owe me some lunches. How do we get restaurants open? And I think the two of us just started thinking about it. Well, wait a minute. Is there something we can do here to help? Scott, obviously, with his background, he understands infectious disease control. And I was like, well, what can we do? I know businesses that I'm talking to right now are actually trying to figure out what to do. They're struggling. And, can we craft something to do this? And it started from there. And, it's still, we're still talking about it now, and it's been pretty exciting, and it's definitely evolved. Scott, what's your take on?
We're both Tempe people, and we just saw how impactful this has been on the places we go to. And in the hospital, I can take care of one kid at a time, but I really got into systems and quality improvement and looking at processes that the hospital goes through to prevent infections. And it gives me a background approach to help businesses apply those guidelines and processes to their business as well, coming up with practical ways that businesses could get their feet under them and get rolling again and still survive all of this time was the goal, because we're all in this together, and any part of the community suffers, we suffer from it as well. I think one of the things that I felt like I could bring to this is just that in my particular specialty, there's not a single approach that addresses, is cookie cutter approach to every patient. Every kid's pneumonia or other kind of infection is a little bit different. They're different patients, have got different backgrounds. It's different problems for each of them. So there's been just an inherent ability to look at a situation and craft an individual approach to that problem that translates really well, we're finding, to working with different businesses, because everybody's issues are different, but they all can use a little help there. Eddie.
You bring up a good point too, because there's something I forgot to add in there. There was a number of months where I was just going to Scott and saying, well, I saw this in the New York Times, or I see this guidance, or I'm working with this business and they're doing this, is this right? And it was always a yes, but, or no, but. And, there was guidance there from CDC, OSHA, and Arizona Department of Health Services. There was all sorts of experts. Some of them were actually conflicting. Some industry experts were recommending things that were not actually good practices. So as we kept going there back and forth, talked to Scott and he said, listen, let's focus on what is actually effective, what is the high impact work that we can do. And many of these things are valuable, but without a plan, an overall plan for a business, they're less effective or less impactful than they would be.
Yeah, they need the approach really needs to be comprehensive and looking at every aspect of a business place, from front door to back door, from all the people that are in there, and it takes a concerted kind of global approach to looking at the business to come up with a plan that's going to be effective. You can put all your energies into one part, but if you don't even realize another part of it, it might all be for naught.
Man, I could speak to that frustration of, especially initially, but even now, conflicting reports and information. There's just so much information out there. I mean, this isn't unique to coronavirus or anything that's happening right now. I should eat better and work out more is basic information that everybody knows. And yet here I am. So it'd been great to be working with you guys, but it's the entrepreneurial story, right? You walk around, you see a problem. I can create value for society in solving this problem. And here we are today. I think one of the interesting conversations with you guys that's shifted in my mind a little bit, how to think about this, is the problem was exacerbated enough because of coronavirus that we, as Max 6, said, all right, we're going to take action on some things and create some plans and some new ways that we do business around here to mitigate some of the risks. But you guys have spoken to me before about how even in 2017 or 2025, or when we've largely gotten past where we are right now, it's not like any of this goes away. We still, we could have healthier workspaces, more productivity. Can you speak to that a little bit and kind of what this might look like if we're not attacking what's right in front of us today?
Yeah, absolutely. It's a great point. It's one that we get asked all the time as well, which is okay, is this just a coronavirus thing? We got a vaccine that's coming along. Vaccines are getting rolled out. Is everyone just going to get protected from that? What are you going to do with your time after that? Right now, definitely the biggest focus for businesses and individuals is around the coronavirus. And yes, we've got vaccines getting rolled out. Eddie's been helping in that delivery system a little bit. I'm sure you can fill in on some of those issues in a bit. But at the same time, we're seeing new mutations of the virus that are starting to spread. We've got some preliminary information that some of those vaccines are going to offer some good protection against that. We don't know so many things, though, yet. We don't know, what does it just protect against severe infection? What's the real world impact on transmission of infection? Maybe you don't get it as sick and you stay out of the hospital, but if you're still spreading it, all of those things are going to have an effect on what the guidances are down the road. So we don't know what the landscape COVID-wise is going to be 6 months from now, a year from now, and we're taking steps to help prepare for that possibility that it is still a significant ongoing issue. But it's more than just that. And we talked to influenza. Influenza has been around forever. It's not showing any signs of going away. And there's data from a few years ago when we had a particularly bad influenza season. Estimates in terms of impact on companies, businesses. In the United States, there's tens of billions of dollars of productivity lost every year due to influenza and respiratory illness absenteeism. There's over 100 million work days lost every year from that. And that's on the macro scale. On the personal scale, you've got, we still have 20 to 50,000 deaths from influenza every year. 30 to 50 million people a year get infected with influenza. Now, what's really interesting and drives home a point that the things that we focus on for businesses have broader impact than just coronavirus is that I just saw the other week that the number of cases of influenza reported in the state of Arizona is down like 95% from recent years.
Wow.
That's just real solid reinforcement that the things that we do focused on COVID have impact on other things that were here 5 years ago are going to be here 5 years from now. And it's all about the employees and such.
Yeah, and that gets into the, if I take a step back and just say the intentions of why we did this in the first place, there were times where Scott and I wanted to push a little bit faster on launching the business, but it was really important that we do this right. And we saw, people were struggling, we were helping them, but we didn't want to jump too quickly without making sure that we were really providing a value. And this was a value that was going to be there in the future. And as we started talking to more and more people, we were working with manufacturers, restaurants, people that, some of us are really lucky we can zoom it in. I've been working from my house. I'm really, privileged that I have a lifestyle and the ability that I can work from home. But people that work in manufacturing, people that work in restaurants, they can't do that. And we rely on them, and we rely on what they do to make it all work for us. And so when we looked at how we could help and having it be valuable and seeing to ourselves and hearing from the clients, well, we had really bad flu year last year in 2019, or 2017, 2018 hit us hard. And we looked at the data. This was a good model in 2017. It certainly gives us a little bit, I think it's an easier marketing strategy now in 2021 than it was. But we think that even when things are getting back to normal, and really, we also wanted to have a business that we were cheering for things to get back to normal. We're fans. We're fans of businesses being open. We are fans of businesses operating safer. And so all those things had to align in our minds just to be happy and fulfilled with the work we're doing. Back to the data Scott's talking about, it's tough because there's, we looked at a lot of different statistics, and we'd love to have more real solid information. And even recently, the New York Times posted an article talking about percentage of deaths extra per year. And they actually took all deaths total. And they saw, when you look at that, it's interesting because the death rate in the last year was higher for all causes, because there's an impact when hospitals are full and beds are full. But if you even look back 2017, 2018, I think there was a 10% increase in mortality, all causes, in a bad flu year. And they had talked, health professionals had been talking about that being one of the worst flu years from 2003. We don't think that's going away, that we think there's going to be a new normal. And what we're trying to do is help get a normal where businesses are open, businesses are safer, but they're just using the science, and they're using, the right science. Much easier when you do the right things.
And when you think about the psychology of it, we've been conditioned for the last year to social distance, to wear masks, to wash our hands, which are all great things. But that transition might not go away. Who knows when it's going to go away. But if you think about if you're around someone and they sneeze, what's your reaction? Your reaction is oh gosh, get away, what's happening? And so that's not going to go away from people. And so I think our behavior at work is going to be different. And people are going to have expectations of some level of protocol or safety. And I think that's so great, because terrible flu seasons are awful. They're deadly, but they also, they do all of the things you were talking about, Scott. They impact productivity. And there's also the stress in the culture, because someone shows up to work, like pre-pandemic, people would show up to work sick because they're trying to get their work done. Uh-huh. And I'm really, 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 really hopeful that is a thing of the past, and people are going to stay home when they're not feeling well. My husband and I were just talking the other day, because our kids have, they go to a small Montessori in Tempe, and, we would get health alerts all the time, like stomach viruses, flu, cold, the lice, all those things. We haven't gotten any this year.
Yep.
And I'm like, so it helps all of these sorts of things, which keeps our kids in school, which, is a great thing. So all this to say, I think this is the future of workplaces. And I think it's going to be a really important role. And I am so grateful for people like you. I was reflecting also on, we were in the 1-year anniversary, right? It was March when we had our lockdown or shutdown when we first, in the US anyways. I think back to that panic that we all felt. I know personally, I felt a lot of panic and a lot of confusion, and Scott and Kyle and I at Max 6, a lot of huddles of like, all right, well, what are we going to do? Because we are in a unique situation where with a co-working space, we have all different companies, but we don't, it's not our company to set policies, right? So we were in this unique situation where we were just kind of reading the guidelines. And like you said, there was all this conflicting information, and we were trying to make the best and figure out a balance, but we didn't have a background. And so it's great to not feel that panic anymore, but it's also amazing that we're able to engage with you. So I would like to kind of just share, could you talk us through what your process is? And you can use us as a case study of what you found, because we did the very best that we could. But I still don't even know, did we do a good job? How would you?
Yeah, I'll let Eddie.
Short answer, yes, you did a good job. So
a great job. And the suspense, you guys are doing a great job.
The too long didn't read. You guys did a great job. Yeah. But also that's a interesting point, because it speaks to most of the people we speak with. They're doing a great job. People aren't hiring us to come in and fix a mess. They're hiring us because they have a workplace culture, and they have management buy-in that people are important. And that's one of the great things for Scott and I, because it's kind of hard for me to deal with people otherwise. And so there's a whole slice of clients that just are not going to appeal to me, which is fine, And so whether it was talking to Kyle and Scott McIntosh, and saying, well, we know that there's things that we need to do, but we want to do the right thing and the right thing for our community. That's awesome for us, because we get to deal with that. I'll pivot really quick, just because you brought up stories, and you guys have that story. And one of the things with the data that I wanted to say is, so there's all this data, billions of dollars of productivity, deaths, loss, I can't personally verify all these, but I have these experiences where we work with the clients, and we have a restaurant we work with, 24 Carats, Sasha Raj and her management team, Chandra, and the team there. They think of their employees like family, and they're worried about. So they're not thinking about, well, we had this productivity. They have people that, if people are off shifts, people are working 60 hours a week to keep the restaurant open, or people are worried about loved ones that are ill, or making sure people are safe. We've got manufacturers that, the company could go, could lose a whole shift of operations, or they could lose money. People could lose jobs. And so that is the kind of data that's amazing that we have access to now. And so that's a great pivot to you guys. First of all, I was a Max 6 community member just by the virtue of what you guys present. And Scott and I really dig what you guys do, what you're about in the community. I've gotten over the last year, getting involved with Tempe business, and Tempe community has just been a pretty amazing thing for me. I hadn't had that in my past work life. And so we already saw a commitment here. So when we worked and approached with you guys, we knew you were doing great things. I mean, spending money on PPE, spending money on hand sanitizer, it's amazing what companies are doing right now. You go everywhere and everyone's trying to do the right thing. And we appreciate you guys looked at it from a standpoint of, let's bring in someone to just verify what we're doing and take it a step further. Scott, why don't you speak about that?
So like you said, people are putting out great effort and doing their best job to try to interpret these guidelines and do the best by their customers and their employees. But the reality is, you guys are great business people and run your business. Most people don't have a background in public health or infection control or epidemiology. And it gets hard, as you've seen, looking at guidelines that are intentionally written broadly and generally enough that they apply to all situations. And they're written based on science and guidelines. But if you don't understand the background that leads to the writing or what the underlying principle is, sometimes you're left looking at all of these as if they're all equally important in all situations. And sometimes people just need a little guidance of, okay, how does this apply to my specific business, and what's the best impact here in this setting? And that's where my infection control experience comes in as helpful. I spent almost 20 years working in the infection control department at Phoenix Children's Hospital, and constantly you end up with a situation that, here it is, how do we make this better? How do we make the best of this situation to decrease the risk for transmission in that setting? And this isn't and these businesses, they're not any different from that. You have people and a place and processes, and you have to look at what's the underlying transmission and the infection transmission issues behind that, and you come up with a plan. So what we do when we come into a business that we're partnering with is we start at the front door. We start at the front door, the entry point to that place, and we walk it all. We walk the entirety of the business. We go to a place like, okay, who works over here? What is this? What are the interactions here? And, we work with all of the people and look at everything that goes in there and try to look at it through our lens of coming up with recommendations for that business. I mean, that's the broad strokes of what we do.
Yeah, and I want to get back. You said the process. So generally, we're providing consulting for infection control planning, training, certification. The general process is we're first talking to the client to find out what is the challenge that they have. Yeah. I've worked in a lot of different industries. I've worked in restaurants. I've worked in manufacturing. Scott, surprisingly, I was a little worried about working with a doctor. And I've worked with doctors in the past, and some of my former clients might be listening to this, and they'll know who they are. But they have reputations for a reason. But what's interesting is Scott is as an ID doctor, there's a background in, you actually have to know a lot of different infectious disease doctor. You have to know a lot of specialties. You're always learning, and you really have to have an open-mindedness that I've found has been great, because even if I've worked in a lot of different industries, I don't know the person's business. So we have to start by listening and talking to them. And so like when we talk to you guys have a very unique space with clients. You have your own employees that you want to take care of, but you also have a community of different businesses. And so, we have that discussion where we talk about what are those challenges, what are the concerns. We, having been a member of the space here, it was a little bit of a cheat sheet, because we got to see, okay, well, there's always masks available. There's a policy at the door. A lot of the main things we knew there wasn't going to be pushback. And really what we're not bringing up anything that's not already listed in CDC or OSHA guidelines. But what we're doing is taking that and applying to the business. So the next step is that we'll do an on-site assessment. And like Scott said, I guess the simple way to think about it is it's like a homeowner's inspection report. We're starting at the, and I don't know if Jennifer saw the one. Yeah. I'm always a little nervous when we send that out, because yours was like 85 pages, right?
No.
But we make it. We were trying to make it. It's an evolution, but we're trying to make it as easy to go through. But we want to make sure it's thorough, so you can see all the different areas and where are the high touch places. Where are they? How are those processes? And Kyle, Scott, Steve, Chrissy took a lot of time with us to walk through different areas, including going through the manufacturing space. We had leased buildings. You guys have a gym. It's amazing. Who has that right now? I know no one does, because I was shopping co-working spaces last year before the pandemic hit, so, but it adds complexity, and you guys wanted to make sure it was safe. And so we go through that process, and we do a report, and it's a draft. It's a draft report because we put in what we see and what we have as maybe first draft ideas of how to help, but no one knows the space better than the customer we work with. No one knows their business better than the business owner. So then we have an opportunity to have that follow-up discussion that I know we're scheduled to have and work with the customer with. And then really, we have not yet met a challenge that somebody couldn't implement something one way or the other. I mean, there's more than one way to do things. And this is the beauty of working with Scott. What I've really enjoyed is, so the science informs the guidance. You have the guidance, and it's intentionally vague. I've worked in the dietary supplement industry. It was an FDA regulated industry. Guidance can be tough, and you want to have it not be overly prescriptive so a business can actually function. And so we take what I think is the hearts and the brains of that guidance from Scott's scientific background of what's informing that guidance, of why it's written the way it is. And as we saw, guidance has changed too, talking about aerosols. And so Scott gets to the heart of why is that guidance there and what's important, and then how does that apply to your business, so we can just make a decision with you guys as to what the best plan is. And then once, at the end of it all, you have a plan that's clear, concise, specific for your business, that makes sense for how you operate in your community. And I know that was a big for you guys, because it's not just the folks that work for Max 6 directly, but it's a whole community of people, and which is exciting for us too, because the impact is even greater of how we can help. I hope that gets to that.
It absolutely does. And it's we are so lucky is not the right word. We're so grateful to have the opportunity to work with as many people as we do every day. But it's a big responsibility to, whether that's, hey, we have to have safety be a number one priority over at the warehouse in particular, with moving parts and machinery. And even here with the gym, like you said, or the meditation room, give people the opportunity to incorporate wellness into their routine as easily as possible. It's striking me now, and I hadn't thought of it before, but because let's talk to these guys, because I think they can help us with the problem that's right in front of us. But what you guys sell, the product offering, is everything you're talking about, the 80-page report, and going through that and helping us to shift our practices and our procedures and our processes so that we can do some of that risk mitigation. But it really, what is it at the end of the day? Yes, that will keep people safer. And what's the feeling like when somebody walks into our space, that they feel like, okay, I have all of the known risks in front of me now if I decide to leave my home. I can feel like I can just show up and do what I love and do my job. And I'm fascinated by these cross practices where someone learns something in one thing and uses it in another form. And we're combining business and science and the medical side of what's going on with really, it's helping us to go through all of our systems and our processes of, this is going to keep people safer. This is going to mitigate some of the risks. But why are we doing things like this in the first place? Why are we doing how people enter one of our co-working spaces up here? Let's rethink that as we're going through all of this and think about, is there a more efficient, effective, better way, better experience for people, whether or not there's a global pandemic going on? And just things like the Medici effect. I mean, there's a great book, really interesting study of how people use these. How does a team of surgeons learn from a F1 pit crew about total efficiencies of having a team moving around each other? This stuff is so fascinating that I hadn't really thought about it until just now, but there's so much more to what you guys do than just the product of offering risk mitigation. I mean, you're giving us our ability to have our lives back.
That's awesome to hear. I think, for us too, I love the idea of bringing in these specialties that it's not a business practice. I mean, none of the companies I've ever worked with has had a infection control physician on staff. So I love that you can bring that in. But what you get to too, I'm seeing so many commonalities, and maybe this is the serendipity we talked about earlier, Jen, and just working with the Tempe Chamber and working with you guys. And there's so many people, and I've seen this whole zeitgeist, and especially in this local community, of just good business and the power of people and how important they are. And it's fun for us because we get to be a part of that in a small way, and I'm learning a whole language. There's a whole language in that, whether it's learning about Simon Sinek from, Brian Stinson at Peak Culture, or we're talking to you and learning about different things, Jen, at the seminars that you've done at Max 6. It's awesome how we're fitting in there,
Yeah, and it's really been, Eddie's lived his life in business and consulting and working with companies. I'm just a simple caveman doctor. I live in the hospital. I see patient. I treat patient. I go home. This has been a whole new world for me. That's been amazing journey already, and I feel like we're just getting started on this. But seeing behind the scenes of how companies work, what their key processes are, learning all the things that go into starting up a business and getting out there, especially a field. There's no one's playbook that we're able to pick up and copy and just start here. So that's been just mind expanding as well. It's been amazing.
I said this last week, and I'll say it again: that business or anything is just people. That's what we do. What are we in business to do? It's people. It's being a good leader for the people that are on your internal teams, that you can serve the people that you serve better every single day. Nothing else matters. It's all just quantitative metrics and stuff to figure out how well are we doing with those two things. And so, us cavemen business folks are learning the other side of it too, of like, oh wow, we can take this knowledge base and make what we've been doing shift a little bit, and look how much better we could do this, so that we could keep people safer, give people the opportunity to show up and do what they love, not feel like they're coming into an office and bringing something back to their kids, or whatever that is, whatever that looks like. That's the real world that we live in. It's all about people.
Absolutely.
So shifting gears just a little bit, and this question is for you, Scott.
Yeah.
What is the state of COVID in our state? No pun intended. Like where are we at? What are you seeing?
Yeah, it's better than it was a month ago. It's still worse than it could be, or we'd like it to be. It's still having a huge impact on hospitals. The hospitals are still very busy on the adult side. It's shifted from a point of almost on the verge of breaking their capacities at the peak of this, around Christmas and into January, to where the volumes have significantly fallen off from that for a multitude of reasons. But there's still a lot of it out there. The direct infections have a bigger effect on the adult population, to the point where a lot of the hospitals that take care of adults and kids, they've shifted over parts of their previous pediatric spaces are totally taken up with adults now. That puts a bigger crush space-wise on the pediatric end of things, because they don't have as much capacity. So they're pressured to get through things as quickly and efficiently as they can. We've got expanded the age ranges in some of the hospitals, where to take a load off of the adult physician colleagues, the pediatric doctors are taking care of people up into the mid-20s in some of the situations. So it's still really busy. And then in pediatrics in particular, there's this issue of MIS-C. It's a syndrome that some kids are having after an infection. It's true that children are not, as a rule, as affected by the acute infection as adults, although I've seen plenty of children that are very severely affected by the acute infection. But some children have the syndrome about a month later, where they have this a kind of a immune response on overdrive where it's causing a lot of inflammation throughout the whole body. And the normal response to the infection is enough that it causes symptoms that puts kids very ill into the hospital. And that's a steady stream of kids that it's kind of the echo aftermath of the peak of Christmas, January time. We're seeing all of these children now who we're evaluating for this aftermath of COVID infection. And that takes up a lot of our time. We see new patients of that realm every day.
Something I've been curious about is COVID unique where it seemingly hasn't affected children as much as an adult population? Is that unique where the flu would sort of bypass a lot of that the same way, or is it other than when you get these really severe cases?
Yeah, I think one of the issues that kind of spares kids a little more than elderly and other issues is a lifetime accumulation of underlying risk factors. Obesity, chronic lung disease, diabetes, those are all things that if you have them, they put you at higher risk for having a bad outcome if you get COVID infection. And we have kids who have chronic lung and heart disease conditions. Those are a majority of the ones that end up in the hospital are the kids that have these other underlying risk factors. But those risk factors and age, old age and a weakening of some of the immune response as people age, those probably address the largest amount of why the impact is so much bigger in the adult population. And no doubt we see some otherwise totally healthy adults get severe disease as well, and in children as well. But for most infections, there's some range of, kids get it worse or adults get it worse. So it's not totally unique in that part, but I think it's largely the underlying risk factors.
One thing to add on that too, that Scott's educated me on that I've learned is I think we, some of us that aren't scientists, aren't doctors, we're like, you don't know all this right now? Like there's, I know I would ask Scott questions all the time and I was bothering him and I think we all have to learn that this is a part of what science is. Science is learning. I mean, it's still, even though it's felt like an eternity that we've had to deal with this, but it's really this, we're still learning. There's still variants. We're still learning how the efficacy of these vaccines. Scott had mentioned, I've been involved and was fortunate enough to spend some hours doing help with the rollout. The logistics of having a vaccine that has to be, defrosted or thawed and then have separate doses. I mean, there's so many people working really hard. And if this was something you could just put in a refrigerator or a closet and roll out, it would be a lot easier. Mm-hmm. And so there's some unique logistics of that. There's new variants, there's new vaccines. So, I mean, it's going to be a ride this year. And yeah. I don't know if
there's someone asked me one time, was like, oh, how come we just don't have like flu, vaccine clinics everywhere? Why is this taking so long to roll this out? And I just I said, when was the last time this country ever tried to immunize the entire population at the same time against something with a vaccine that is new and has, it's all uncharted territory. I have families asking me, what's the long-term prognosis of this for my child? And I say, we haven't been taking care of this disease for even a year yet. We're learning how people are doing a year after the infection right now, but there's just so much we're still learning, and it's still a big effect on the hospitals.
One interesting thing that's come out of this, there's all kinds of interesting things. From a 10,000-foot view, if I was just an alien looking in, all of this is fascinating, right? I was trying to explain to my 5-year-old son what science was the other day, and here, plug your ears for part of this, but I said, it's all just math and word problems and experiments, and everything else is magic. But I think that's part of this, is that nobody knows, so much of what our experience is. Nobody knows everything, and we're always learning, and this is just one of those things that it's hard to be comfortable with the position we're in right now, which is the answer is we just don't know.
Yeah, it's a key thing, science is asking questions. And it's expanding knowledge based on asking educated questions about situations that you see. And all the disciplines of science, they are asking questions to better understand situations. There's a misunderstanding, I think, that scientists know everything about a given problem. And they don't know everything. They know what they know what they don't know, and they ask questions to move on to the next thing. And sometimes and this goes to where there have been changes in guidances. There's an initial recommendation based on a best understanding at that time, and then questions get asked, understandings advance, knowledge advances, and you realize, okay, that wasn't quite the way we had it, and there's an alteration to a recommendation. Maybe there's more of an emphasis on ventilation and handling because there's more airborne transmission than was initially thought. It was never thought that there was none. It's a shift in degrees. So recommendations can change over time. And the problem when people don't understand how that scientific process evolves is then they say, the scientists, they didn't know anything. And that gets frustrating when you have guidance that changes. And one of the keys we have is we stay on top of that and we factor in those changes to guidance and recommendations as they come along. Yeah. Science is not static.
And we can pivot that back to clients. It reminds me, it's a communication problem too, that because they'll say, well, it doesn't show. I was reading something, and I don't know if it was in the Times, where they were talking about of some verbiage that CDC had used to describe aerosols, and it was accurate, but it gave an impression that it wasn't an aerosol issue. But it gets back to communication, and that's also part of what we hope to help companies with. And you guys do a fantastic job. Is you want to communicate then what are you doing and why. And when you have a good communication plan and you're being transparent and you're talking about being a good steward, it's about, people then understand the why and they understand why you're doing this. They understand what the plan is, and then they feel better. In some cases, it's perception.
It's everything got so politicized last year too that, this isn't flip-flopping. It's just asking new questions.
Right, it is.
Yeah.
So I do have a curiosity question about changing guidelines. If you're up for it.
I'll try.
An infectious disease buddy as well.
Yeah.
So I read recently that the new guidance or suggestion is to wear 2 masks. Is that a thing?
I saw that come out. There's issues with the practicality of it. I think it's any mask is better than no mask. Any covering is better than no covering. Part of the issue that's the reality is there's a range of effectiveness of what people go to for face coverings. This guidance helps put a bit of a safety net into what some people may have been doing previously, which is insufficient masking. More layers of a multiple layered mask is better than a simple coarsely woven, scarf or bandana or some of the neck gaiters. When there's a recommendation that focuses on the masking, you get more effective masking done by everybody. And I think that's probably part of the rationale behind it. There's not really a huge new understanding of the virus that leads to that. But if there's any increase in amount of aerosol transmission that's recognized, the double masking, it goes into the point that it protects both ways. First, the message was mostly that it keeps virus inside you, keeps you from spreading out, but there is protection against what comes in to you as well. And that's where having a little bit more robust layer of the masking
is there helps. Scott, is there a more elegant way of talking about the Swiss cheese element? I mean, there's a Swiss cheese element in infection control where it's,
multiple layers of protection.
There's multiple layers of protection because unless we're going to live in bubbles, we're going to come in contact. So there's never 100% effectiveness unless you're 100% right now in that screen, Jen. but that, yeah. So it's part of that too, right?
Yeah, I think it's a relatively simple way that people can add an extra layer that may take their mask protection from 40% protection against inhaling something to 50 or 60%. Incremental improvements in all of those can, on a macro scale, have a big impact. A lot of the cloth masks have got little pockets inside them. People insert coffee filters inside of them. People insert masks like this inside of cloth masks. And I've worn them that way. You don't even realize it after a while. But those are additional layers that give you a little bit extra protection.
Well, thank you.
No, you're welcome.
So we have a little bit of time left, and I have one more question, I guess, business related, and then we have a couple of questions we always ask that have nothing to do with anything, just because we're curious and we're collecting answers. So the one answer is, if I'm person XYZ listening to this show right now, I run a business, I'm concerned about everything that's been going on. What do I do? Do I call you? Why do I call you? Is it because or is the CDC going to kick my door down if I don't, or my people are going to be not safe?
I'm going to let Eddie handle that one.
So I'm going to say I really hope the CDC is not kicking anybody's doors down. I don't think it's going to help, but I hope people start researching. If you want to reach out to us, we Scott and I had talked about it too, and you've seen it. We've got a resource page and a link page in our reports. If anyone that's listening wants to email us at info@WorkingAware, mention Max 6 in this podcast, and we'll send you guys a link to a lot of the relevant guidance, whether it's from CDC, OSHA, AZDHS. We have I think that you've seen that page where it's got the link. We think it's really helpful. And so we want to offer that because first and foremost, we know we'd love to help everybody, but we can't help everybody. And there's some people we know that we've been doing some pro bono work, and we're going to continue to do it. There's some folks that just they're hurting. They can't afford to have someone come in. So I would say reach out to us and talk. We don't charge you to talk to us, and you can go to our website and book a free consult with me. If you want some free information, we'll send you some free information too. We're going to be putting together some webinars. We did one with City of Mesa Cares program where we give some more information about how the guidance is informed by the science. And I'll probably reach out to you, Kyle, about and Jennifer on advice on that, because you guys do such a good job of communicating out and educating people. So we have some plans there, but reach out to us directly. You can go to our website, WorkingAware.com, and we'd love to hear from you and see how we can help you.
And just a quick plug, we're right in the middle of it with you guys right now, and working through this. But the balance that you guys have struck between here's things that are going to mitigate some of the risks, and we can do these things, balanced with, if we take that too far, you're going to go out of business, and all the operating costs and the money that this takes. And so how do we do this effectively as a business to stay in business and do it, cost effectively as we can and efficiently? And I just really appreciate that, as it's been a trusted partnership that I know that we can have that conversation, and not just like we're butting heads, but how are we partners in this solution to come up with a better way?
Yeah, we don't want to, and we couldn't if we tried to come in and tell people what to do. We've got to partner with businesses that really want to improve their situations.
Okay, so you ready for the first completely random question?
Go.
All right. For each of you, what is your favorite book of all time?
Oh, God. Well, I'll go first. I guess business book, a business book. I love the book that's kind of been my thing in the last 10 years has been Thinking Fast and Slow. Daniel, I think it's Kahneman. The person that got me into that book actually sent me one called Harebrained Tortoise Mind, which is very similar to it's a little bit different, but it's talking about Kahneman is a psychologist and economist, and it's another example, I think, of maybe the Medici effect of taking those different backgrounds or expertise and applying them differently. But that book has really helped me with decision making and looking at my own mental biases and then how I think and it's been great. So that's been probably my favorite one.
Great. Thank you.
I've not read a lot of busined books in my medical career.
Any book is fine.
But one of them that I really struck me at the time, and I'd probably go to is Jared Diamond's Guns, Germs, and Steel. It's a really high-level, multidisciplinary look at history of mankind and really how the impact of climate and geography and infectious diseases have really led to the rise and fall of civilizations across the world, and why one part of the world is where everything developed and took off and spread to other parts. It's a history book that's not just dates, times, places, and people, but looking at the systems that go into that. This really struck me when I was reading it.
We're going to ask this question too many times at some point. I'm going to have to live at the library. I'm so interested. Jen, what about you? Go ahead with your question.
Those are awesome recommendations. So my question, which is funny asking you guys, but is what's one lesson that you've learned through last year or through the pandemic that you plan to carry with you forever or for a long period of time? It could be a personal lesson, professional lesson.
I think it seems a little obvious, or it's everyone's lesson, but the flexibility that and the resiliency of humans to adapt to situations shouldn't be new. We've seen it before, just the scale that we see it on here. And it's easy to get doom and gloom about everything, but it's also energizing to see what people are capable of coming up with as solutions to these processes, and we're still ticking along, and so that's always refreshing.
Yeah, so for me, this year was so much fun just learning about this whole community here in Tempe and Max 6, and whether it was Local First or I'd been in business and working. I worked at a business for a really long time, but it was national in scope, and I still have great relationships with those folks. But I hadn't had this local community, and it is a company that had grown and gotten pretty corporate and pretty big. And I came back to sort of my entrepreneurial roots this last year, and it was just really eye opener because it just really felt like home, and I've met some amazing people, and just it's been great. So I mean, I think trying to find those silver linings, right, has been super critical for all of us. Yeah. So
it's been amazing to see this show up in my life at different points, but we are adaptable creatures, and community will be there from day one and day whenever, and that's what's really important. I mean, we'll figure. That's what we do. We figure our way through it, and it's going to change and shift all around us, and it's going to feel uncomfortable sometimes. But hey, we're going to end up on the other side of it, having learned something, and look back and say, like, that wasn't that much different from anything else I've gone through in my life, and it's been really interesting. Say the website one more time as we close this show out here.
Absolutely, www.workingaware.com, and just how it sounds, workingaware.com. And you can email me either directly, Eddie, E-D-D-I-E, at workingaware.com, or info@workingaware.com. And we have some free information we definitely want to give listeners. So
perfect. Thank you, Dr. Scott Ostdiek and Eddie Fredericks, for being on the show today. And we are off to continue building better communities where people and businesses thrive.
Thank you for listening to the Future of Work Water Cooler Conversations with your hosts, Jen Burwell and Kyle McIntosh. Each episode shines the spotlight on business leaders who are defining what a healthy and productive workplace looks like in Arizona and beyond. To be part of the conversation, schedule a visit of the Max 6 Entrepreneurial Center in Tempe, Arizona, and connect with us at max6.com. Remember to like and subscribe to the Future of Work Water Cooler Conversations on Apple Podcast.